Infertility can be one of the most emotionally draining experiences a couple can go through. And for men, there's a silent condition that often goes undetected until it's too late. Sperm blockage. Imagine this. Your body is producing healthy sperm, but none of it ever reaches its destination. It's like running a marathon only to be stopped just before the finish line. The result? A zero sperm count, shattered hopes, and delayed dreams of parenthood. If you or someone you care about is struggling to conceive, this video may hold the answers you've been searching for. Today, we're diving deep into sperm blockage, what it is, how it happens, the symptoms to look out for, and most importantly, the modern treatments that can restore your fertility. Stay with us to the very end. You don't want to miss the breakthrough solutions we'll cover. Understanding sperm blockage. Let's begin with the basics. Sperm are produced in the testicles, specifically within the seminiferous tubules. From there, they begin a journey through the male reproductive system, traveling through a complex network of ducts and glands before being expelled during ejaculation. Here's how the process is supposed to work. Sperm leave the testicles and pass into the epididymis, where they mature. Then they travel through the vas deferens and mix with seminal fluid produced by the seminal vesicles and prostate gland. The final mixture, semen, is what is ejaculated during orgasm. But what happens if there's a roadblock somewhere along that path? That's where sperm blockage or obstructive azoospermia comes in. In this condition, even though the testicles are producing sperm just fine, the sperm cannot make it out due to a physical obstruction in the ducts. As a result, the ejaculate contains no sperm at all, leading to infertility. Causes of sperm blockage. Now, let's talk about the culprits. What causes these blockages? Well, sperm blockage can result from a wide range of factors. Some you're born with, others you acquire over time. 1. Infections. Infections are a major cause. Sexually transmitted infections like chlamydia or gonorrhea, if left untreated, can lead to inflammation and scarring in the reproductive ducts. Even non-STD infections like epididymitis or prostatitis can cause lasting damage. 2. Surgeries and medical procedures. Vasectomy, while an effective form of contraception, intentionally blocks the vas deferens. But sometimes, even unrelated surgeries in the pelvic area can accidentally damage or scar the ducts, leading to unintentional obstruction. 3. Congenital abnormalities. Some men are born with conditions like congenital bilateral absence of the vas deferens (CBAVD). In these cases, the ducts never form properly in the first place. This is often linked to genetic conditions like cystic fibrosis. 4. Cysts or tumors. Cysts in the ejaculatory ducts or prostate gland can physically block the flow of sperm. Even benign tumors or swelling from trauma can create enough pressure to cause a blockage. 5. Environmental and lifestyle factors. Long-term exposure to high temperatures, like using hot tubs excessively or working in high-heat environments, can affect sperm production and duct health. Similarly, habits like smoking, poor diet, and lack of exercise can increase inflammation in the body and contribute to blockages. Symptoms to watch for. Sperm blockage is tricky. Many men have no idea they even have it until they try to have children. However, there are a few warning signs. 1. Low ejaculate volume. The average ejaculate volume is between 1.5 to 5 milliliters. Men with blockages often notice significantly less, sometimes under 1.5 milliliters. This is because the sperm and seminal fluids are not mixing properly or being expelled. 2. Azoospermia, zero sperm count. This is usually discovered through a semen analysis. Even if the volume is normal, the lab may report no sperm present. That's a red flag for a blockage. 3. Pain or discomfort. Some men experience pain during ejaculation or in the area around the prostate. This can be due to built-up pressure behind the blockage. 4. Hematospermia, blood in semen. Blood in semen is never normal. It may signal irritation or injury caused by the obstruction. 5. Blood in urine, hematuria. If the blockage affects surrounding structures, it could cause bleeding into the urinary tract, resulting in blood in the urine. Diagnosis. So how is sperm blockage diagnosed? It starts with a visit to a urologist, preferably one who specializes in male infertility. Common diagnostic tools include semen analysis, scrotal and transrectal ultrasound, MRI scans, testicular biopsy, hormone blood tests. A testicular biopsy is especially important. If sperm are found in the testicles but not in the ejaculate, it confirms that sperm are being produced but blocked from exiting. Effective treatments. Here's the good news. Sperm blockage is often treatable and in many cases reversible. Let's walk through the primary treatment options available today. 1. Seminal vesiculoscopy. In this minimally invasive procedure, a tiny endoscope is inserted through the urethra into the ejaculatory ducts. Blockages are located and removed, allowing the ducts to reopen. It's quick, safe, and highly effective. Transurethral resection of ejaculatory ducts, TURD. TURD is a surgical procedure used when cysts or structural blockages are involved. Surgeons remove the obstruction, restoring the flow of sperm into the ejaculate. 3. Assisted reproductive technologies, ART. If surgery is not an option or fails, sperm can still be retrieved directly from the testicles or epididymis through procedures like PESA, percutaneous epididymal sperm aspiration, TISA, testicular sperm aspiration, micro-TIS, microsurgical testicular sperm extraction. These sperm are then used in IVF, in vitro fertilization, or ICSI, intracytoplasmic sperm injection, offering a high success rate for conception. Recovery and prognosis. Recovery from surgeries like vesiculoscopy or TURD usually takes about a week. Most patients report minimal pain and a quick return to normal activities. The success rate of restoring sperm and ejaculate can be quite high, sometimes over 50% depending on the underlying cause. And even if natural conception isn't possible, sperm retrieval combined with ART makes biological fatherhood a real possibility for most men. Let's recap. Sperm blockage is a common yet often overlooked cause of male infertility. If you're experiencing low semen volume, pain, or have been diagnosed with Azoospermia, don't lose hope. Early diagnosis and modern medical interventions can dramatically improve your chances of becoming a father. If you found this video helpful, please give a thumbs up. It really supports our channel. Share it with someone who may be struggling with infertility. It could make all the difference. And don't forget to subscribe for more science-based, compassionate health content. Subscribe, comment below. Do you want a video on male fertility diet or lifestyle tips? Share with a friend or in a health group. Your path to parenthood may have challenges, but with knowledge and the right medical support, it's far from over. Thanks for watching, and we'll see you in the next one.